on the final stretch of Talk the Doc, and it is time now to take some questions from our audience. Yes.
Hi, Doc.
Hi.
Is autism hereditary? I mean, are there ways to prevent it if the family has a history of autism?
There are studies saying that autism can run in families. Actually, if one child is affected, they say there's an 8% higher chance that a second child might have autism. Now, as to prevention, because the cause has not yet been discovered, the exact cause or the exact gene hasn't been discovered, so right now, there aren't really ways to prevent it. But what we're after is we want to minimize the symptoms of autism, and that's what we can do with early intervention.
Talagang it's key. You mentioned that earlier.
Correct.
It's a good time to repeat it. We have a question, Doc, from Janice Rodriguez. She sent us via email. She says, what are the similarities and differences in symptoms of autism and ADHD, and how do I know if it's autism or ADHD? Madagdag ko na nga, they always talk about savant when they talk about autism. Can you explain these things? Yeah.
Okay. Maybe let's differentiate ADHD and autism, or what we refer to as autism spectrum disorders. The basic difference is that you don't see social skills impairment in children with ADHD. So in autism, you have that trial of impairment. They may have difficulties with their social skills, with their language skills, and they have the ritualistic behaviors. And children with ADHD, on the other hand, don't manifest this. However, both autism and ADHD may have symptoms of hyperactivity. So that's an initial presentation that you can see in both conditions. Now, when we talk about autistic savant, this is a particular trait wherein some individuals with autism may have splinter skills. So to give you an example, let's say this child isn't able to converse like we do. But when he starts reading, you don't expect a child who doesn't converse to start reading words and paragraphs. So that is what we refer to as a splinter skill.
Tsaka yung talagang highly talented in
Correct.
like piano or
yung
art,
perpetual
mga ganyan,
calendars,
diba?
if you ask them, anong day yung June 28, 1968?
Oh, alam nila kagad.
So, ganun. So those are splinter skills. But not all individuals with autism have it. So there are these special individuals that have those skills. So sometimes it's a challenge for parents, for children with autism, it's a challenge for parents to find where is that particular skill, what particular skill does my child have, or what particular interest does this child with autism have, and then they build on those talents that they can find.
And is it possible also, Doctora, that some of the symptoms or some of the observations from when they were young disappear when they're older?
Correct. Yes. Like, you don't usually see, like the ritualistic behaviors that are common in younger children with autism. A lot of times, some of them will just fade away. But sometimes it's replaced by another perseveration or another ritualistic behavior. Okay, but then over time, you'll see that the manifestations change.
You know, I guess we have to be cautious. It doesn't mean that the condition is gone, no?
Yes.
It's just a different, iba na itsura.
Correct. Correct.
All right, another question from our audience.
So, hi, Doc.
Hi.
Some people have this notion that children with autism have a shorter lifespan. How much of this is true?
Children with autism have the normal lifespan. So unless they have any other physical condition, then you'd expect that they will live as long as we do. Okay, so it's not as if, let's say, children with Down syndrome who have heart problems, then for these people, for these children, you'd expect pwedeng ma-affect yung lifespan nila. But for autism, they have the normal lifespan.
From an email question, similar to what was asked a while ago, can a couple, will it be possible that they would have 2 children with autism?
It's possible. Actually, twin studies are saying if one has autism, there's a higher chance that the second twin will have the disability as well. And as I mentioned, there's a higher rate for succeeding children. So compared to the general population, wherein you have that 1:91 prevalence, for succeeding children, they have that 8% higher chance than the general population to have it.
Okay. One more from our audience.
Hi, Doc. What is the right or ideal age to have a child screened for autism?
Okay, actually that's a very good question po. When you say screening, it's not only for individuals in whom you find delays already. When we say screening, it has to be done in every single child, even without complaints from parents or from let's say teachers who see them. And the American Academy of Pediatrics suggests that it should be done at 9 months, at 18 months, at 24 months, and at 30 months of age, regardless of symptoms that you see in a child. So more so in children wherein you see symptoms already. So the earlier you go for screening, the earlier we can detect the delays and the earlier we can intervene. Kasi
That's the purpose of your
intervention is
center, the Center for
Developmental Pediatrics. Yes. The medical city has come up with this center kasi diba, pediatricians are busy and not all of them are confident enough to do the screening themselves. So what we did, there's a team of developmental pediatricians in medical city, and what we did was to come up with a center, and the main purpose of the center is for everyone else to refer children, normal, typically developing children, to our center to have them monitored and to have them screened.
Okay.
All right, we have one more pahabol from our audience. Yes.
Hi, Doc. What other therapies that can manage or treat autism?
Right now, in the Philippines, we have a very wide range of therapies that we can offer. Actually, whatever they have in the States, we replicate it here. So for the traditional approaches in autism, we have the occupational therapists, we have speech therapists, depending on the needs of the child. But there are also some other practitioners who do the biomedical approaches. So some of them modify the diets, or some would do injections or vitamin supplements. So those are some things that we see being done in the field right now.
We had a question, I think it was an email question that was I told about earlier. May kinalaman nga ba ang yung parang intermarriages, like if you marry a relative, does that increase the possibility of autism?
Actually, there's no relation. You'd probably get some other disability because if let's say you have recessive genes that run in the family, then it becomes manifest in the next generation, in your offspring. But for autism, I haven't encountered any studies that say interfamily marriages.
What about the mother's age, Doctora? Because they also, with cases of Down syndrome, that has to do with age. What about autism?
For autism, mother's maternal age is not a factor.
Okay, well, that's good to know. All right, we have very little time. We'll ask Doctora for your last words.
Parting words? Okay. Well, I'd just like to invite everyone to our center. Developmental surveillance and screening is key because we want to intervene early. So we would like to encourage everyone to go for early intervention, and the way to do this is to approach your health practitioner because you are partners with your doctors, and well, we want to foster that partnership.
Doctora, thank you so much for joining us. We learned so much from you in such little time. I'm sure our audience did also. Thank you, all of you, for giving us your time and asking your very intelligent questions.
And to our televiewers, thank you for watching our show. For our next episode, we'll be talking about weight management in adults. So if you have questions about this topic, you can email them to us. I'm Dr. Oy Balburias.
And I'm Chiki Roa Puno. Remember, don't be afraid to ask because we can talk to Doc.
Your doctor has seen many different patients, but none exactly like you. You are unique. The more your doctor knows you, the better he can help. And the more you know about your condition, the better decisions you can make. So tell your story, ask questions, talk to doc.
Your health depends on you and me.
A message of concern from the Medical City.